So let's just say that you've had this nagging knee pain for a while, and you've done the usual treatments to try and see if it would get better. Like at first you probably just ignored it, hoped it would go away, and then after that, maybe you modified your activity a little bit. Perhaps you did some ice, maybe you did a brace, medications, Tylenol, Advil, and this thing has just been going on, and you're trying to figure out whether or not a knee injection might be the next reasonable step for you. And do the injections actually work? Well, I am Dr. Brad Homan. I am a board-certified orthopedic surgeon. I have been in practice for over 20 years, and I've treated thousands of patients with knee pain, and I've done probably hundreds of thousands of knee injections. And so I'm going to go over in this video the major common injections to treat knee pain and what every one of those does and whether or not it might be something that would be of some benefit to you specifically. So the main injections that we're going to talk about are going to be cortisone, what's called Visco supplementation or hyaluronic acid. And then we've got some regenerative medicine options, which are injections like platelet-rich plasma, alpha-2 macroglobulin, stem cell therapy. These are all the most common types of knee injections, and I'm going to go over what each of these is used for, the different indications, and I'll tell you everything that you need to know about these injections. So first, before we get started, let's talk about the anatomy of the knee and what kind of conditions are usually causing knee pain. So I have got my plastic knee here to give you a visual to see what kind of things would cause knee pain. So the first thing, and one of the more common causes of knee pain, would be arthritis. And this tends to be in older patients, but it could be a younger patient that had a traumatic cartilage problem in the past. A cartilage is basically a cushion on the ends of the bones, and when that starts to wear down, there is inflammation associated with that process. That inflammation causes pain, swelling. It can also cause things like locking and popping because the cartilage starts to kind of break down in an uneven way. So you get different areas where the cartilage is missing and then different areas where it's intact, so it essentially makes it a rough surface. So arthritis is going to be one of the causes of knee pain, especially in older individuals. Then there are things like tendinitis or inflammation of the tendons. So the tendons connect the muscles to the bones, and around the knee, one of the biggest tendons is going to be the quadriceps tendon. Also, you've got the patella tendon. There are multiple others that are not on this knee model because basically all of your thigh muscles surround your knee joint, and all of those muscles have tendons that will attach somewhere around the knee. So if the tendon becomes inflamed, that tendinitis can be a source of knee pain as well. In a similar way, the ligaments are basically the structures that will connect the bones. These are bands of tissue that look kind of like tendons and act in a similar way, and they keep your knee from moving too far one way or the other. Rotation and side bending, they sort of lock it all together so that you don't have any abnormal movement. But ligaments can also become inflamed, and when they're inflamed, that can cause pain as well. The last thing that typically can cause pain in a knee is what we call a meniscus problem. And the meniscus are these little rubbery cushions that are inside the joint, and they act basically like shock absorbers for the knee. And so meniscus tears or meniscus degeneration can also be a potential source of pain. And so different kinds of injections may work more effectively for the different conditions depending on what that is. So what injections are supposed to do? I would say the main reason that we do knee injections would be to decrease pain, decrease inflammation, and often those two go hand in hand, and increase the function. So we're trying to get the stiffness out of the knee, the swelling out of the knee, get it to feel better so that you can perform and do your regular activity of daily living without any significant discomfort. And so what we're trying to do in most cases is modify the symptoms of the problem, or at least get the pain to go away. Whatever the issues are that you're having, you want to get those to go away. So in many cases, it could be potentially a band-aid versus disease modification, which means we're trying not to just get rid of the symptoms, but we're trying to actually cure the problem if possible. And so the first injection that we're going to get into is cortisone. Cortisone is probably the most common injection. It's sort of a first-line therapy. Cortisone is an injectable steroid, and the purpose of a steroid is to reduce inflammation. It is not a pain medication. It is not a numbing agent. It has its effect because it reduces the inflammation that's causing the symptoms. And so in many cases, cortisone would be the first line of an injection when someone has failed the normal conservative treatments. And again, as I mentioned earlier in the video, the normal things that you would do after your knee has been bothering you would be modify your activities, meaning stop doing the stuff that hurts for a little bit and see if your body can heal naturally. Medications like Advil, Aleve, and Motrin are called non-steroidal anti-inflammatory medications. Using those for a short duration of time might be effective if you don't have a contraindication to taking those medications. Medicines like Tylenol is a pain reliever that might be effective. Ice, heat, things of that nature. Compression with a knee brace potentially would be could be of some benefit. But then after that fails, then cortisone might be the next best step because it can potentially reduce the inflammation that's causing your problem. For a tendonitis, for instance, it can reduce the inflammation in the tendon before that inflammation causes permanent damage. In many chronic cases of tendinopathy or tendon inflammation that's been going on for a really long period of time, that inflammation will actually damage the tendon tissue. And then once that happens, getting rid of that without surgery can be very difficult. But if you can get an injection of cortisone into that problem before it becomes degenerative, before that tissue becomes changed and degenerative, then it can potentially cure the problem. So in certain tendon inflammation, certain ligament inflammation, or if you have a flare-up of arthritis, cortisone can be extremely effective to reduce the inflammation. In the cases of early tendonitis or ligament tears, it can resolve the problem for you. If it's an arthritis situation, it can definitely break the cycle of inflammation and give months and months of pain relief. The less severe the arthritis is, the more effective those injections can be. Cortisone is used a lot. I use it a decent amount in my practice as well, and it can be very effective for the correct indications. But you have to be cautious with cortisone because it does have some downsides. Too many cortisone injections can actually cause tissue damage. It'll cause atrophy of the tissue, and that potentially can make it weaker. And in many cases, large tendons, we do not inject those because it predisposes those tendons to actually rupture and tear. So cortisone needs to be used for the correct indication, and it can be very effective for certain conditions. Other side effects would be increase in blood sugar if a patient is diabetic. So if you happen to have some blood sugar issues, steroid medication getting into your system will raise your blood sugar temporarily. Other side effects can be variable. I've had some patients say cortisone injections make me crazy, or my wife can't stand me when I'm on cortisone, or some people will say gain weight when I take cortisone. So most of those side effects are minor. Most of them don't really occur that often, but there are different side effects that you potentially could get with an injection of cortisone. Moving on to the next shot, Visco supplementation, also known as hyaluronic acid. So this injection is only for knee arthritis. And basically, if you failed cortisone or you can't have it or don't want it for some reason, and you've been through other conservative treatment options and you're not getting better, hyaluronic acid or Visco supplementation can be an effective injection to help get rid of the symptoms of the arthritis. And basically what's going on is when you have arthritis, the inflammation in the joint reduces the normal viscosity and the normal effectiveness of your regular joint fluid. So joint fluid has sort of an oily texture, and it helps to lubricate and cushion the inside of the joint. But inflammation from arthritis will actually make the synovial fluid more watery and less viscous and less effective. So with Visco supplementation, we're trying to restore the normal viscosity in the knee joint. So these injections are usually covered by insurance after you get an insurance authorization. There are formulations that are 3 injections once a week for 3 consecutive weeks. There are some other formulations that are just 1 injection where you put it all in at once. That can be a pretty effective treatment option to reduce the symptoms of arthritis when cortisone and or other options have failed. They have minimal side effects. It's not really a drug. It's basically synthetic joint fluid, so it doesn't cause any systemic issues at all. Next injections are going to be what we call the regenerative medicine options. And regenerative medicine is basically trying to harness your body's own healing power to have the desired effect of either curing the problem or reducing the symptoms. And the 3 main regenerative medicine treatments are going to be PRP, or platelet-rich plasma, alpha-2 macroglobulin, or A2M, and then stem cell treatments. And it is important to know that these regenerative medicine treatments are extremely effective, but they are not FDA approved, but they are FDA allowed, and they're not necessarily covered by regular health insurance. So these injections may not be for everyone. It kind of depends on if you're trying to look for a more natural approach to healing, or you're trying to avoid a surgical procedure and you've already been through most of the conservative treatment options, then regenerative medicine options may be the best for you. So platelet-rich plasma, what is it and how does it work? So PRP, or platelet-rich plasma, is a procedure that takes about 30 minutes. We basically take blood from your arm and then we process that in a machine that separates the blood into layers. We take the plasma layer that has the platelets and all the growth factors, and then we inject that into the problem spot. And what we're essentially trying to do is stimulate a new injury. We're trying to stimulate a healing response by telling your body, like, hey, there's something going on over here. And the way that I tell patients is when you get injured and blood vessels will break, those platelets in your blood are the first thing to jump into action. Not only do they clot if you're bleeding, but they also secrete all of the chemicals that tell the cells in the area to come in and start a healing process. And it takes stem cells that are in the neighborhood, and those cells can differentiate into the tissues that you need. And it also stimulates increased blood flow, because that's how we heal, is with blood flow. So PRP can be introduced into tendon problems, ligament problems, meniscus tears, if it's the right kind of tear. And what that will do is stimulate the healing response and resolve the problem completely, because it tells your body to get in there and start a healing process. Even in cases where the tendon or ligament is degenerative because of chronic inflammation, PRP can be effective in having your body completely heal that degenerative tissue instead of needing to go to surgery. It lasts longer than cortisone injections, also tends to last longer than Visco supplementation for arthritis, but it's a slower process because unlike cortisone, for instance, which is a drug and works fairly quickly, this injection will stimulate a healing response, and it generally takes several weeks to have its effectiveness. But it can last for several months and potentially even longer than that depending on the case, and it potentially could resolve and completely heal the problem. So alpha-2 macroglobulin is the next one, and alpha-2 macroglobulin is a protein that is found in your blood. And A2M, or alpha-2 macroglobulin, works by inactivating inflammatory chemicals. So when you have an injury or when you have arthritis, that inflammation that is produced, those chemicals that cause inflammation are what cause pain, swelling, and also can cause further damage. Alpha-2 macroglobulin is a very effective protein to basically inactivate all those inflammatory chemicals. So most of the research on A2M has been done in knee cartilage. So what we've seen in mostly animal studies, but some human studies as well, is that the alpha-2 macroglobulin can prevent arthritis from developing when cartilage damage has occurred. So for instance, if there's a traumatic injury to a knee, like an anterior cruciate ligament rupture, a lot of those patients naturally will go on to arthritis down the road. Alpha-2 macroglobulin has been shown to decrease the progression and strengthen up the cartilage so that you don't get arthritis down the road. So it's very helpful for mild to moderate cases of arthritis in the knee. It has been used in other conditions as well, such as spinal problems, tendinitis, and other itis type of inflammatory conditions. But the main research on alpha-2 macroglobulin has been for knee cartilage. Next one, stem cells. What are stem cells and how do they work? So I mentioned earlier in the video, when you get injured, the platelets secrete signaling chemicals to the cells that are in the area. Stem cells are cells that are in your body that can turn into whatever tissue your body needs. So they can differentiate into cartilage, they can turn into muscle, they can turn into bone. So they have the ability to turn into whatever your body needs depending on the signals that are in the area. In addition to that, stem cells can themselves secrete more chemicals to bring in more healing. So because they are living cells, they stick around a lot longer than just platelet-rich plasma, which are the chemicals in the blood. They can stick around for months and potentially turn into whatever you need it to turn into to fix your problem. So very effective to heal damaged tissue like tendinitis, like ligament problems. But in addition to that, it can also stop the symptoms and halt the progression of arthritis because it stops the inflammation that breaks the cartilage down and makes arthritis worse. So from a natural healing perspective, the stem cells will secrete chemicals that will stop the inflammatory process, potentially turn into cartilage cells to build up the cartilage that you do have. But at minimum, it stops the progression of that disease process. Be careful, because I am not trying to tell you that stem cell treatment will grow all of your cartilage back, because that is not what happens. But what we do see is substantial pain relief and the halting of the progression of the arthritis for a substantial amount of time. If you do want more information on PRP and stem cells, check out my other video where I go into much more detail about these two treatment options. So the bottom line is that knee injections will definitely work for the correct indication in the correct patient. And in general, what you're trying to do with injections is heal without surgery after you failed regular treatment, or in the case of regenerative medicine like platelet-rich plasma or stem cells, you can accelerate the healing of an acute injury if you're trying to get back to sports or activities of daily living more quickly. I'm Dr. Brad Homan. I hope you found this video useful. If you did, please like and subscribe and hit the bell for notifications, because I'm going to be rolling out a lot of other content about knees and other things that hopefully you'll find useful. I hope that you're loaded up with some knee knowledge and know what to do when your knee has been giving you trouble. So take care of your knees and they will take care of you.